What is DIOS and cystic fibrosis, and how is it treated? Imagine your digestive system as a busy highway where food and waste travel smoothly. In cystic fibrosis, thick sticky mucus can clog this highway, especially in the intestines. One common complication is called Distal Intestinal Obstruction Syndrome, or DIOS. It happens when this mucus, combined with undigested food and waste, causes a partial or complete blockage at the junction where the small and large intestines meet. This area is known as the ileocecal region. Because of its similarity to a condition seen in newborns with cystic fibrosis, DIOS is sometimes called the meconium ileus equivalent. Cystic fibrosis, the problem starts with a defective CFTR protein. This protein normally helps regulate fluid movement in the body. When it doesn't work right, mucus becomes dehydrated and thick in many organs, including the intestines. This thick mucus slows down the movement of food and waste, making it easier for blockages to form. Many people with cystic fibrosis also have pancreatic insufficiency, which means their pancreas doesn't produce enough digestive enzymes. Without these enzymes, digestion becomes less efficient, leading to malabsorption and stool that is thick and sticky. This combination of factors increases the risk of developing DIOS. Symptoms of DIOS can vary but often include crampy pain in the lower right side of the abdomen, bloating, and a feeling of fullness. People may notice fewer bowel movements or constipation, and sometimes vomiting can be severe. A palpable mass in the lower right abdomen might be felt during physical exams. In some cases, watery diarrhea occurs, which can be confusing. Because these symptoms resemble other conditions like constipation or appendicitis, doctors often use imaging tests such as abdominal X-rays or ultrasounds to confirm the diagnosis and rule out other issues. Treating DIOS quickly is essential to prevent complications. The first step is usually rehydration and correcting electrolyte imbalances, especially if vomiting or diarrhea has caused dehydration. Doctors often recommend osmotic laxatives like polyethylene glycol or stool softeners to help loosen the impacted stool and mucus, making it easier to pass. Enzyme replacement therapy is also important. Taking pancreatic enzymes with meals helps improve digestion and reduces stool thickness. Pain management can help ease cramping discomfort. Sometimes, a nasogastric tube, a thin tube inserted through the nose into the stomach, is used to decompress the stomach and relieving pressure. If these measures do not work or if the blockage is complete, surgery may be needed to remove the obstruction. Prevention is key in managing DIOS. Staying well hydrated, taking pancreatic enzymes consistently, and establishing regular bowel habits can help reduce the risk of mucus and stool buildup. For people with cystic fibrosis who experience recurrent DIOS, close monitoring by their healthcare team is vital. Early detection and treatment can make a big difference in avoiding serious complications. In summary, DIOS is a serious but manageable complication in cystic fibrosis caused by thick mucus and malabsorption. Recognizing the symptoms early and seeking prompt medical care with hydration, laxatives, enzyme therapy, and sometimes surgery can help keep the digestive system functioning well. Always consult healthcare professionals for personalized advice, as each person's experience with cystic fibrosis can vary. Maintaining good digestive health is essential for overall well-being and quality of life in those living with cystic fibrosis.